It-
So you're coming to Dancing Prairie at the end of October. I'm really looking forward to it, and I've spoken with some students who are also really looking forward to it. Uh, will you tell us a little bit about what you're going to be doing with us?
I'm excited because this is probably my favorite class of everything I teach. We're going to do nerve releases. So we're going to do tests that show you that the first place where nerves get entrapped is in the neck, around the facet joints, around the scalenes. And we're going to show you how to clean all that up, get the facet joints opening, use breath work and rib work to stretch the scalenes. We're going to do some amazing work with that. We're going to be doing, so the Sperling test would tell us that the problem with your carpal tunnel is really in your neck. And then we're going to do things that look at clavicular rib space, which looks at scalenes and pec minor, functional clavicles. I mean, there's so much new stuff. A lot of Eric Dalton's work, and I want to dedicate this to him, by the way, a lot of his work is going to be taught in here because we're going to look at rib clavicular function. We're going to look at pec minor, which means we have to revisit the capsule work for the shoulder. When we get to the lower body, let's finish the upper body. A lot of people think carpal tunnel is a wrist problem. But radial nerve, ulnar nerve, all that starts in the neck and shoulder. So we're going to explain to them, if you have nerve pain in the arm, you need to clear the nerves in the neck. That means normal cervical curve, normal opening of facet joints, get rid of the scar tissue of cervical strains. You have to be able to stretch pec minor, but you need to drop the humeral head and hydrate the capsule to do that. And then we're going to show you some really cool stuff for ulnar nerve, radial nerve, median nerve of the wrist, some really cool ways to treat that. My favorite part's going to be the second day, though. The second day, let me get this psoas up. I had a client that had a torn psoas. And so what was scarred down, and I'm going to just show you this as an analogy, is the femoral nerve. And we're going to show you how to get that femoral nerve really healthy. We're going to show you how to get the sciatic nerve in the back really healthy. We're going to show you how to treat iliolumbar ligaments to get rid of nerve compression, L3, L4, L5, S1. We're going to show you how to pull. This is my favorite. Wait till you see this one. My favorite new toy, my wife has this going on, and she's got fluid that's pushing out that disc space. Well, we have a technique now that opens the disc in the front and pulls that fluid back in off those nerve roots. So some of the things we're going to teach are just amazing, like so cool stuff. I'm excited.
When a client comes in and presents maybe with some neuropathy in a foot, what kinds of things are you thinking?
Gigi, when you have peripheral neuropathy in the foot, it's usually tibial nerve, fibular nerve, but that branches off the sciatic nerve and the femoral nerve. That branches off the brain and spinal cord. We still go back to the neck. So even if I had a young man, it's funny you asked that, but I had a young man, he was told it was because of his cerebral palsy, he had foot drop, right? And I treated his brain stem, spinal cord, dural tube, sciatic nerve, branches of the fibular nerve, his foot drop went away. But when they just treated his lower leg, his foot drop didn't go away, because even though we're going to look at how the fibular head compresses the fibular nerve and how to get that fibular nerve released, but the fibular nerve has to feed off the brain stem, the spinal cord, and the sciatic nerve. So we have to still look, and the highlight is going to be amazing. We've had people that have had diabetic peripheral neuropathy, and their leg was so black that they were going to amputate their legs. And between the work we're going to do and microcurrent, their legs have recovered. They've prevented these patients from having amputated peripheral neuropathy, diabetic neuropathy. We're going to look at some of that research, which is amazing. This is the best class ever. I have never taught a class that has this much amazing joint stuff, ligament stuff. We're going to release bones on nerves, scars on nerves. We're going to floss nerves. We're going to do stuff that we've never done before anywhere around the country. It's going to be really cool.
Boy.
Really amazing workshop. I'm so excited.
That's just great. All right. Well, is there anything else you want to say to people who are considering this workshop?
The other thing is, if they want to hang out after class or something, it's Halloween weekend. I know you're a big Halloween person. So let's just have a good weekend and let's all have fun. Let's bond like we've always done at your facility. You have a beautiful school, beautiful heart. I'm just looking forward to coming back. And I know that if you could only take one of my workshops, of all 13 that I teach, this is the one you do not want to miss.